Good afternoon, everyone. Thank you for joining us. On today's briefing, we'll hear from Milwaukee County Executive David Crowley, City of Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management, Dr. Jeanette Kowalik, Commissioner for the City of Milwaukee Health Department, and Darren Rausch, Health Officer and Director for Greenfield Health Department. Thank you all, and County Executive, we'll start with you.
Thank you so much, Catherine. Good afternoon, everybody. I hope everybody had a great weekend. And as everybody knows, that we had a very hot weekend, and I know a lot of people had a chance to really enjoy the 4th of July. And so we know folks went to the parks, gathered together, whether that was at their home or at a park or anywhere. And so we just want to continue to encourage folks that you need to get tested. Because we were out and about, it's extremely important that folks understand that we have to get tested. Especially when you think about, Bradford Beach in particular. We've seen a lot of people out there wanting to enjoy themselves, and it's good, but we, at the alarming rates that we're seeing so many people gathering, we know that it is an issue. And so we want to let folks know that, again, if you are out, please go get tested. And we want folks to understand that we know you're tired of being in the house. Nobody wants to continue to stay cooped up and just sit at home. And so if you're going to be out, please make sure that you are practicing physical distancing, you are wearing a mask, and practicing good hygiene. So please make sure that you keep hand sanitizer and continue to wash your hands. I'm also happy to say that, because of this weekend, more and more people are actually going to get tested. So we've seen an uptick of folks utilizing our National Guard sites. And we know that testing is critical in making sure that we minimize the spread of COVID-19. So if you were out, again, please call 211 to find a testing site near you so you can get tested. And as we talk about testing, I want to remind folks that Milwaukee County, we do not have a health department. So we are limited on what we can do. We are still requiring masks in all of our county facilities. But I just want to let folks know that we are working diligently with all the public health officials about what we need to do in order to continue to move forward. And while we continue to talk about our parks, last Friday, we had the opportunity to launch our Love Your Parks campaign, which is really about making sure that we can get the community engaged and finding ways to really uplift our parks. And it's really a time where we can go out and talk to the community about how you can give your time, talent, or treasure. Your time by volunteering in the parks to help us clean up, your treasure, because we could definitely use many of those donations and making sure that we have great parks, but also your talent, making sure that you can share stories about why the parks mean so much to you. And so we're really excited about this campaign because, we see so many people who are coming to utilize our parks, coming to utilize our trails because of the COVID-19 pandemic. And to be quite frank with you, is one of the safest places that you can go outside of your own home. It is outdoor. We still are asking you to wear a mask, but this is an opportunity for us to have safe spaces for families and friends and everybody to enjoy. But also it's a mental health break. It gives us the opportunity for us to get out and, enjoy the environment while we are still here and enjoying this, because we know that the COVID-19 pandemic has really put a damper on many different things. And so we are looking at about a $10 million shortfall when you think about our parks department. And that's one of the reasons why we launched this campaign. We need everybody's help because we know that our parks are extremely important to everybody. And because we've seen lost revenue, because there isn't any events going on and not too many people who are able to rent out park space, we could use your help. And that's why we want you to utilize Love Our Parks program. But also want folks to know that the Milwaukee Parks Foundation is also accepting donations from individuals and businesses to help us out. And we've also created a partnership with both Sprecher Brewery and Beer Capital. And so there's a beer that you can buy called Park Life, and a portion of those proceeds go to the Milwaukee Park Foundation to help us continue to have great parks. And so I want to make sure that we can continue to have great parks. These are natural assets that we all love, that we all can enjoy, and we have to continue to invest in them, especially during these tough times. So with that, I will send it over to Mayor Tom Barrett.
Thank you, Mr. County Executive, and thank you for the work that you're doing at the county. I appreciate it very, very much. The county executive talked about the testing, and I just want to run over a couple of those numbers because I think In some ways, it's a double-edged sword. Obviously, we're pleased that more people are getting tested. In fact, yesterday at UMOS, we had 831 people tested at UMOS. At Custer Obama, we had 647 people tested yesterday. So we're seeing an uptick in the number of people being tested. But as Dr. Weston and Commissioner Kwolek will tell you, we're also seeing more cases. And that, of course, is troubling for all of us. When you look at the overall trend, I think it's pretty accurate to say what we have seen is we've seen a continuing decline in the number of deaths. And that's something I think we can all be very, very pleased with. But we also now are seeing an increase in the average number of cases, which in some ways, at least if you look at the history of this, is a precursor to having more hospitalizations and more deaths in the coming weeks and months. So I'm hoping that that is wrong. But again, the science up to this point has been a pretty accurate indicator. When you see the cases increase, that's going to be followed several weeks later by the increase in hospitalizations and then by an increase in deaths. And when you look at the map of the United States, and in particular the western and the southern states, it's inescapable that we are certainly not where we want to be. I have to say that when you think that we're basically now almost through 3 entire months of having this pandemic, I don't think any of us had certainly expected that it would be this intense, this long. But that's where we are right now. And unfortunately, unlike a number of countries around the world, we're not seeing the reprieve that we had hoped to see. And there are other countries that have been far more successful than the United States in curtailing this and controlling it and flattening the curve. That clearly has not happened here in the United States. And that's something that I think we all are very, very mindful of. And that's why we're continuing to look at other measures that are important. The Common Council here has had discussions with my administration, with the city attorney's office, with the health department over the use of masks. And that is something that we are continuing to work on very diligently. It's something that Dr. Weston has been preaching. I think it's accurate to say for several months now. Commissioner Kwolek has talked about it extensively. And based on our city attorney's advice, we're taking the route of going through our Common Council. Other communities have taken other routes. For example, Dane County just today announced that it will go with a countywide masking policy, and that has been generated by the county health officer, who's a joint health officer between the city of Madison and Dane County. Our structure here in Milwaukee County is a little different. As the county executive said, there is no county health officer. Each of the municipalities has a health officer. And that's why, again, we're looking at doing this at the city level as opposed to the county level. But we want to make sure that it withstands a legal challenge if there is one. And the legal challenge would really come in the form of equal application of the law. We're very, very mindful of the equities that have to be there. And as some of you may know, there's been a rather significant number of restaurants that have asked us to step in. And I think that they recognize that dealing with their customers, that they might have more credibility if it comes from the city. So that's something that we are looking at very, very closely. And we have had several drafts, but we're working with the city's attorney's office to make sure that we're doing this in a way that is the most appropriate for individuals. And clearly there's going to be a difference between how people act outside when they are not close to individuals and when people are indoors. I think that there's a real difference between those two. The third topic that I want to just touch on briefly is an amazing partnership that is related to the work that we're doing here. And that partnership is among the mayors of the 5 largest cities of the state of Wisconsin. Milwaukee, Madison, Green Bay, Kenosha, and Racine. The 5 mayors of the 5 largest cities have gotten together over the last month and a half or so. And we worked together to develop a grant application from a group in Chicago that is involved in making sure that there are safe, fair, impartial elections throughout the country. And the 5 of us submitted a grant application to this organization. And we just received word yesterday that the 5 cities will receive this grant. It's a total of over $6 million. The city of Milwaukee will get roughly a third of that. We'll get about $2.1 million. And that will allow us to address a wide range of issues, from making sure that we've got an adequate number of poll sites. We've got drop boxes for people who are voting absentee and don't want to put their ballot in the mail, but want to make sure that it gets back in time. In increasing the pay for election day workers, that's something we think is very important, particularly during a pandemic. And outreach both to help people vote and help people learn how to navigate the system so they can vote absentee if they want to do that. So we're very, very pleased, again, to have the 5 cities get together and submit this grant. And we're even more pleased that we've received the grant because we know how important the August election is and the November election. And we want to make sure that we're doing everything we can to make this a safe, fair, accurate election. And one of the things that I've been saying since the April election is the April election showed us this is not just an election commission event. This is really a marriage between the election commission and the health department, because the health department was so involved in the April election, and it will be involved in the elections in both August and November as well. So a lot of work has been done, but a lot more work to be done. So we appreciate all the support we can get. And with that, I'll turn it back to you, Catherine.
Thank you, Mayor Barrett. And next we'll hear from Dr. Weston.
Thank you. Good afternoon. First, as always, to our numbers, we have 12,577 confirmed cases of COVID-19 in the county and 358 individuals who have died. Since we talked last week, we've seen a further increase in the COVID-19 numbers around the country. We're seeing states and cities moving backward in their opening up plans, shuttering restaurants and closing down bars. We're also seeing counties around the state with increasing number of cases. There's been a lot of discussion out there that the increase in cases are just due to increased testing. It's a legitimate concern. The more we test, the more cases we find. However, although the numbers that are often discussed and certainly easiest to understand are the number of new cases, the numbers and the statistics that are most concerning is the percent of tests returned positive. So for example, if you do 100 tests and 10 of them result positive, that's a 10% positivity. That number is less affected by the amount of testing occurring. And we're seeing high and increased percent positive values across the country. And this is what's extremely worrisome. And locally in the state of Wisconsin, we've been seeing nearly a doubling of this percent positive, also very worrisome. Hospitalizations and deaths are also critical numbers to assess the status of disease, but it's important to remember that these are lagging indicators. So that means they take a while to rise. So by the time we have overwhelmed EMS systems and overflowing hospitals like they're seeing in other states right now, we're very late in the process, and COVID-19 is much harder to control at that point. Additionally, now that we're seeing a younger population of cases, so changing from an average age of 52 in March to 36 last month in June, this is a population that's less likely to be hospitalized and less likely to get severely sick and die. It's important, however, to remember that this is not necessarily a good trend for COVID to be taking. Although it pushes off the influx of hospitalizations and deaths, we know that young people do not live in isolation. They interact regularly with those who are older and have other medical conditions that make them more susceptible to becoming very sick. So in Milwaukee County, we do continue to have data coming in, but with the data we currently have available, we adjusted our key indicators today, and our cases indicator changed to red. So this is in light of the data showing a significant increase in the trend of percent positive values. This will be critical to continue to monitor moving forward. So what does this all mean? It all means that we need to do everything we can to minimize the influx of cases in Milwaukee County while preparing for the worst. We continue to work on building up our testing, our tracing, our health system, and other public health infrastructure for a potential future rise in cases, a likely future rise in cases. And likewise, as an individual, you can ensure that you're minimizing or really ideally eliminating your close contact with those outside of your household. Ensure that you're wearing a mask in public places and that you're getting tested when you have symptoms. As has been discussed, the easiest way to do that is to call 211. We saw today, as the mayor mentioned, that Dane County has put in place an order requiring masks. And as we see ongoing discussions throughout Milwaukee County and municipalities to consider the same. But in the meantime, individuals can take it upon themselves to make their own decision, to protect their community and wear a mask in public. Thank you and stay safe. And I will pass it along to Commissioner Kowalik.
Good afternoon. Thanks, Dr. Weston. As you noted, we're looking at our indicators to drive how we're moving forward with our COVID response. So the lag in reporting and knowing that the incubation period for COVID-19 is 14 days pretty much locks us into a situation where we can't necessarily look at information as it comes in, that it's a little delayed, and also the processing of that data is important too. So just to be clear again, what the county and the city have been doing is looking at Mondays and Thursdays as the update day for our indicators, the 5 indicators of cases, testing, PPE care, and contact tracing. And that's changing now to just 1 day a week. So Thursdays will be the day that we run the updates for the indicators. And that's important because we do see fluctuations, especially over the weekend, as there's an opportunity to catch up on processing many of the negative cases that run through. So we do see some variance in what's happening at various points in the week, because of course, as you would imagine, we're going to process the positives first because people need to know if they're positive, COVID positive, versus people that are negative that are not necessarily priority for knowing, but need to know, say, for maybe their employer or just peace of mind or whatever. So that's extremely important to acknowledge to the public, is that there's a process that we follow as public health professionals and healthcare providers to make sure people are getting that information based off of priority, again, if you're COVID positive versus being negative, but also knowing that there is a high volume of information that we're receiving and processing and having to use to guide what we're doing for our COVID response. So I just wanted to provide some clarity behind that because there have been many questions from the community and the media related to indicators and how that works. So Friday, the city of Milwaukee provided an update on our indicators, and because there was, as Dr. Weston noted, a red for the cases, looking at the positivity rate, and then also the number of cases that we're seeing, or the 7-day average for cases that we're seeing, that there is a movement in the wrong direction, not necessarily seeing what other communities are seeing as these high spikes, but definitely something that is a pause for us. So we cannot move into another level of making things looser. We're going to hold the line at phase 4. And that means that we will reassess not this Friday, but next Friday, the 17th of July. So please stay tuned for an update. As always, we will still provide a status update on the 5 indicators to show comparison between the weeks. But as far as any adjustments in a phase 4 order, that will not happen unless there's some serious concern by later this week, which will cause us to take a different course of action. So just to alleviate some of the concerns about that. And then also concerns about how these gating criteria have been developed and how we're following them. So we know that we had this set up, and this was a collaborative process, that we would look at us being stable as an opportunity to kind of gate or move into these additional phases. Noting that there's only 5 phases. Like, you know, I know the county has a different situation, but in the city we have 5. And we don't want to just say, oh, because we've been stable, we've had all yellow, or we've had 1 green and 4 yellow, or whatever the combination is, that means we're okay to move into another level, because we are paying attention about the trends in the state and the trends in the region and the trends in the country. So we are, we will revise this to be more about being all green to move into the next phase. So I just wanted to provide that update, because that is an important update. And that also ties into some of the concerns about just kind of coasting along and us not necessarily being in the green, as you may say or will. But I wanted to just clarify that for everyone. And we'll continue to monitor along the way. Hopefully we won't have to look at regressing and tightening things up like some of the other jurisdictions in our state and other parts of the country. But we do want to continue to promote individual responsibility for prevention of COVID-19, wearing masks, hand hygiene, and then of course being mindful about congregating or being around other people less than 6 feet for 10 minutes or more. Again, we're still going with the 10, even though the CDC updated it to 15. But we do know that that is a very risky type of behavior, so we want to continue to put that out there. We also know that there are some questions. We receive questions about physical activity, recreation and sports, about being safe to do various things like playing basketball or baseball, and we're still prohibiting contact sports except for professional teams where there's an approved plan by the Milwaukee Health Department. So I have heard of some things that are going on, and we definitely want to put that out, that we will be enforcing our orders. So we will be having conversations and then move into different levels of enforcement. But again, this is to prevent the spread of COVID-19, and we're not in the clear yet. So it's summertime. I know people want to go back to just enjoying Milwaukee summer, and you know, that's one of the highlights of living here and being on the lake and all of that. But we have to adjust our behavior, and a part of that again is just acknowledging each of our roles, individual roles, and helping to prevent the spread of COVID-19. And as the county exec noted, the need to get tested. If you did anything over the weekend, if you're ever possibly at risk, you're around other people, you are an essential worker, you're out demonstrating or protesting, you should get tested on a regular basis. The community testing sites at UMOS and Barack Obama High School, and then there's others in the area, are great opportunities to access free testing regardless of having symptoms. So please get tested to know your status. And again, when you get tested, it's just not a one-shot deal. You need to get tested every time you may be at risk. So I just wanted to remind everyone of that. And then 2 other points, Milwaukee Cares. So Milwaukee Cares is what we're referring to as our mask ordinance in the city of Milwaukee. And that was reviewed today at the Common Council hearing, and it will undergo some additional revisions. So of course there's questions about indoor, outdoor, age for minors versus not. Of course there's disability exemptions and things like that. But that ordinance is being reworked through legal, and there should be an update in the coming days of what that will entail. So I know that the draft was released to the media yesterday, so there were some questions about like the citation scale and things like that. So those things are being addressed. So more to come on that. There should be some updates later this week on this. And then lastly, we know it's hot outside, so hopefully everyone is staying cool. And we're working on providing options for our community to cool off. So normally we'll say, go to the library, go to the mall, and we know that there's still some limitations there. So we have promoted Bradley Tech High School as a cooling site option, but unfortunately the AC is up, and you know, one could imagine Mercury's in retrograde, so it figures the AC would be out at this point in time. So hopefully that will get up and running again soon, so that can be available to the public. But the North Division High School site is open from 1 p.m. to 6 p.m. So that is an option. It's located at 1011 West Center. And there's also water and meal service that will be available at that site. Anyone that's interested in taking advantage of that cooling site, please enter through the Milwaukee Rec entrance, which is adjacent to the tennis courts, and social distance and mask up MKE will also be able to provide masks on site. So again, just looking for more ways to provide some relief during the summertime. So stay tuned for more updates on that. And thanks all for your efforts in helping us to fight COVID.
Thank you, Commissioner Kowalik. And last but not least, we'll hear from Director Roush.
Good afternoon, everyone. I'm Darren from the Greenfield Health Department, and a pleasure to join you today. I want to echo a lot of the things that my colleagues said in this briefing before. We are not out of the woods yet with COVID. We know there's still a lot of COVID activity, both nationally, within the state, and regionally, and that's something we monitor very, very closely. We need to be especially concerned about growing rates of COVID in our younger adults, those who are in their early 20s and 30s. Certainly we know that the weekend and warm weather, and especially a holiday weekend, increase socialization throughout our communities. And we generally will appreciate and support socialization, but in an era of COVID, we need to be smart about how we're socializing with each other in our community. So if you have concerns that you may have been exposed or you have been exposed, certainly there are a lot of testing options available to you, as other speakers have mentioned. In the suburban communities, we've outlined a 4-phased plan, phase A, B, C, and D. When we went to recommendations back in late May, we are currently in phase C, and actually we've been in phase C for several weeks. But like the city and like Dr. Weston mentioned, we do look at these gating criteria every week, generally twice a week, to see where we're at, and to see what the data is telling us. And as we sit now, as Dr. Weston mentioned, cases are red. That means we're experiencing significant growth in our case rate in Milwaukee County over the last 14 days. So while some of the other measures are good or holding steady, that is one that's certainly troubling to us that we want to continue to monitor. So we want to continue to recommend everybody to do the things that we've been talking about over the last 4 months under the cloud of COVID. We want to continue physical distancing. We want to continue staying home when we're well. And we're highly recommending the use of masks in our community. And you can certainly see the swanky new mask that I have emblazoned with the City of Greenfield logo. And this is what I would encourage everybody to wear when they're out and about in the community, especially indoor spaces, so that you can not only protect yourself, but protect others around you. Lastly, I just want to mention the work of public health hasn't stopped on COVID, and we're aggressively planning with our partners for fall. So this afternoon, I had the opportunity to sit on a call with several school superintendents in my area of the county, talking about the planning that needs to happen for schools. And there's a lot of considerations that need to be made about what schools will look like in the fall, what rules will be in place, will there be masks, how will students be taught, will it be in person, will it be virtual, those sorts of things. So just want to tell everybody out there that public health is working hard to keep everybody safe across all sectors, and schools reopening is one of our key initiatives that we're working on now in preparation for fall. But certainly there are other factors that we're looking at, including increasing testing with our healthcare partners, and then considering what the fall may bring in terms of influenza, other respiratory diseases that may complicate the diagnosis of COVID this fall. So there's a lot of things happening and a lot of moving parts in local public health. We continue to appreciate your support and hope that we can continue to get your support in following these recommendations as we go forward. Thank you very much.
Thank you, Darren. I love the new mask. Looks very sharp. Our first question is from Adriana Mendez with TMJ4, and it's for Commissioner Kowalik and Director Rausch. She asks, in the city of Franklin, they've seen a spike in cases, 37 in the past 5 days. So now the health department is asking bars with live music to cease their entertainment operations until further notice. Are either of you concerned about COVID cases possibly linked to bars in the city or suburban municipalities?
Absolutely. We know that in other places that bars have been the culprit, and I know that there were some questions about that with phase 4 about including bars or not. We are looking at, again, we have an order, so we have the capacity that's still capped. We also have our COVID safety plan pilot, and there have been about a dozen operators that have submitted plans for us to review to have more capacity. We are evaluating that to see the success of that and possibly require that for everyone. Again, that's a bandwidth issue. Of course, it takes time to review plans and provide technical assistance and support. But we do know that there are many operators in our jurisdiction that are restaurants / bars, and that were providing bar service as well as food because they were licensed to do so. We do know that there's a small amount that are strictly taverns, that I think it's like 270 or it's under 300. So, you know, those we can monitor a little bit more closely and be able to make a decision on what needs to happen. But again, we want to, again, provide education and guidance despite having orders, and let operators be equipped to make decisions and uphold and know that the distancing and all of that will be important. Also, educating and really encouraging outdoor versus indoor is important, because we know that airflow and everything is really critical for prevention of exposure to COVID-19. So we're monitoring it, would be my response at this point in time.
Yeah, I would echo everything that Dr. Kwolek mentioned as well. We certainly know that transmission in bars has been an issue. It has been an issue in both La Crosse and has been an issue in the city of Madison. I haven't had occasion to talk to my colleague in the city of Franklin, but I think the decision that she's making and going down that road is an important part of controlling COVID going forward. And if we need to make slight little tweaks to the phase that we're currently in and restrict music or roll back a little bit on the recommendations, I think that's certainly appropriate. Every little thing we can do now to prevent COVID and stop the growth of COVID cases will certainly benefit us going forward.
Thank you both. Our next question is from Casey Cronus with Fox 6, and it's for Mayor Barrett and Commissioner Kwolek. She asks if you can provide more detail about the mask mandate and what people can expect as far as requirements and the fines that they might face if they are not complying.
Very briefly, it's a work in progress, and so we can't because it's not done yet, and nothing has passed the council. The council probably will be looking at it in the next week or so. That's our hope. I would prefer that they don't wait until July 28th. I would prefer that they do it sooner than that if they're going to take it up. But again, we've been working, my office along with Commissioner Kowalek's office, along with the common council members that are interested in this, and the city attorney's office. So again, as the commissioner said, it's a work in progress, and again, we want to get it moving as quickly as possible. I think you can certainly draw a distinction between indoors and outdoors. I think that that's one distinction. The other distinction is going to be probably that business owners would probably have a different set of enforcement mechanisms as opposed to individuals. But again, nothing is cooked yet. So we're doing it as we have these conversations. Commissioner, anything you want to add?
Sure, thanks, Mayor Barrett. So part of this too is making sure that people have access to masks. So we're working on procurement and getting additional masks ready to go. We know Mask Up MKE has been wonderful and has provided many masks across our area, but we're looking at providing the community with a variety of options that are washable. So masks that have different fits. There's the neck sleeve kind of mask. So we're looking at that as an opportunity to make sure that people have what they need, and then getting support from other organizations and groups that will help kind of add to this groundswell of free masks. We know that, some people, you may assume that they have $5 to pay for a mask, or people are living check to check, and $5 can go a long way. So we don't want to create an undue burden on folks. So we're looking at what we can do to be able to support this. And then, of course, the equity aspect, as was mentioned by the mayor, about how are we addressing the ordinance fairly and making sure that there's not, one group being targeted versus another, which we had learned had happened with our stay-at-home order. So we are very mindful of that. We know that, declaring racism as a public health crisis in our city and county is not just an exercise, but it's a culture shift, and we want to make sure we're doing this the correct way. So how is this ordinance supporting that and instilling some of those principles versus just a general ordinance that we're so used to passing and pushing through and figuring it out in the back end?
Casey's second question is also for Commissioner Kwolek and Mayor Barrett, and she asks, would the city of Milwaukee consider quarantine orders for people returning from states with increasing rates of COVID? For example, Chicago is requiring anyone who returns from certain states to self-quarantine for 14 days.
Go ahead.
Go ahead. You can go.
That's not something that we have discussed at this point. I did see where Mayor Lightfoot in Chicago did issue that order. I want to see if it's effective, and it's something that I'm sure the commission and I will be discussing, but we haven't discussed it up to this point.
And we're monitoring that closely. You know, of course, we don't want to discourage issuing orders or requirements or guidelines because of the ability to enforce, but we do consider that. So, you know, if we were an island and we could really monitor who comes in and out, it would be easier to do that. But we know that there's different modes of transportation, and how do we do that? And how do we also solicit support from business owners that, you know, someone may be taking their vacation and they go to Florida or something like that, and they're going to say, oh, well, you know what, you already took 1 week of vacation. I'm not going to give you 2 additional weeks to quarantine. So there's some logistical challenges with this. So we're looking at Chicago, we're looking at other places out east, like how are they monitoring this, and what is it, the impact of it? Is it helping or not?
Great. Mark Stevens with CBS 58 has a question for Director Roush. He asks, are there conversations about mask orders in the suburban municipalities? So making them mandatory versus recommended.
Yeah, so last week I had colleagues from several suburban and city departments that did talk to the Intergovernmental Cooperation Council, or the ICC, here in Milwaukee County. That's the leadership of the 19 municipalities, villages, cities, and towns in Milwaukee County, and several of them raised that issue. At this point, I'm not aware of any that are moving forward, but I do know of a couple communities that were asking questions, kind of seeking some guidance. As suburban leaders, and including the city of Milwaukee, we had said that we would certainly highly recommend masks, but at this point I haven't seen or heard anything moving forward about an ordinance or an order at this point.
Thank you. Virginia Small has a question, and Dr. Weston, perhaps you're able to answer this. She talks about numerous COVID outbreaks being attributed to outdoor parties. So although it may be safer to be in an outdoor bar, if physical distance and masks are not in place, can outdoor bars still become a hotspot?
Yeah, so there's certainly different degrees of safety. And so as a general rule, being indoor is higher risk than being outdoor. But we've seen through beaches, through parties, through outdoor bars, you certainly can still catch the infection. There certainly still is transmission of COVID-19 outdoors. So it's equally important outdoors to, if you're in a public place where it's hard to distance, it's hard to stay 6 feet apart from those not in your household, wear a mask and really minimize the time that you're there.
Thank you. Our next question is from Emily Fields with WUWM, and perhaps it's for Commissioner Kowalik and or our elected officials on the call. She asks, can you talk about the process and rationale for when and where to open additional National Guard testing sites like the one at Nicolay High School this week? Will there be more sites in Milwaukee since the lines have been quite long at UMOS?
So there are some testing strategies, and as a county, we're looking at how can we consolidate our resources to provide some stable coverage, because obviously the National Guard's not always going to be available. So what do we do? So there's some talks about how we do that, and looking at, again, like concentrations or we're kind of anticipating where there's going to be outbreaks and how that will guide where sites are set up. We also know too that there's some logistical considerations for sites. Like you have to actually make sure there's ample space for cars. Like the UMOS line yesterday was ridiculous. So we want to make sure that it's not like a neighborhood where it's difficult for cars to navigate. We definitely want any fender benders or anything when people are trying to get tested. So that's also one point. But of course, we're looking at sustainability of options for testing in the area. So more to come on that.
And Dr. Weston, did you have anything to add as far as context for that?
Just so the rationale for the National Guard testing sites as well as place-based testing sites, there's 4 main criteria that are looked at. So extent of infection outbreak, comorbidities, so medical comorbidities, looking at equity, socioeconomic vulnerability of a population, and then likelihood of community transmission. And so process is basically the health officer, the local health officer can request a testing site. And then since it is through the National Guard, it would be sent to the state and approved through the state.
And that was the point I was going to make. This is a partnership, a true partnership between municipalities, the county, and the state. And so whatever decisions are made will be in conjunction with the state of Wisconsin. And we've worked directly with the governor's office as well as the various departments to ensure that we've got good cooperation among the different layers of government.
Excellent. Thank you all. Sharon Bagenda with CBS 58 says she understands that the mask mandate draft is still under review, but she asks if Mayor Barrett or Commissioner Kowalik can expand on the enforcement piece. So what would people be looking at as far as fines, and how would that be enforced?
Again, until something is passed, I think it would just be pure speculation. There's 15 members of the Common Council who are going to want to weigh in on this. And there are certainly equity issues that come into play. Who will actually enforce it, I think, is an issue. Will it be the health department? Would it be the police department? The draft that is being circulated right now uses more of a health department model than a police department model. And then, as the commissioner mentioned, there's the whole issue of a supply of masks. And so while all this is going on, there's work being done to make sure that there are an adequate number of masks, because you certainly can't have a mask mandate and then not have an adequate number of masks. So again, that's why there are a number of moving parts here. And I think one of the advantages and one of the disadvantages of having these briefings is you're sort of getting a real life demonstration on how sausage is being made. And what I mean by that is, as we're developing the public policy, it's very transparent, because we're having these conversations and trying to share as much information with the public as we can as we're developing the policies.
Thank you. Our next question is from Mark Stevens, and it's for the county executive. Mark Stevens with CBS 58 asks, why are the beaches open? And county executive, can you comment on that?
Yes. So one, when we think about our parks and our beaches, these are places that people can go to minimize the spread. So we want people to enjoy that. But it's also important for folks to understand that we are still recommending that you still practice physical distancing and wear a mask. And so when you think about our beaches, when you think about our parks, these are places that people could come, they can enjoy themselves and still minimize the spread of COVID-19. I have not seen any reports yet about how Bradford Beach or any of our beaches have contributed to the spread. But right now, it's important that we give people that space. But again, we need people to police themselves, practice physical distancing, and please, please, please wear a mask.
Thank you, County Executive. The last question that I'm seeing is from Mary Spacuzza with the Milwaukee Journal-Sentinel, and it is regarding the mask mandate. She asks, Mayor Barrett, do you have any changes, or do you support how the mask ordinance is written? What changes would you like to see? And could you institute an ordinance without Common Council approval?
Well, I've seen several drafts of the ordinance as it's being circulated or as it's being developed. So I'm not certain as to which one is the one you're referring to. And we're continuing to work with Alderwoman Dimitrievich, along with the city attorney, along with the commissioner, to make sure that we have, first of all, language that would pass legal muster. Second, that it's fair, and third, that it's effective. So again, it's very much a work in progress. So I'm not trying to dance away from it. It's just that we're literally trying to make sure that we get this right, so that if and when we do have an ordinance, it'll be one that's enforceable and effective and fair. Those are the goals we're looking at. So could you institute an ordinance without council approval? That's a conversation we've had with the city attorney's office. The city attorney has weighed in that he feels that it is important to go through the council, although I will note in Dane County, it went through the health officer in Dane County. So obviously there are different schools of thought here, but as of right now, we are looking at that model. And I still think that that's a workable model. Again, if the numbers start going in the wrong direction, and if the council refuses to act or doesn't act, then we'll have another conversation, but I don't think we're at the point.
Thank you for that clarity. And Tom Durian with Team J4, I believe, is asking our final question, and it's for you, Mayor Barrett. When we have the DNC, what will COVID testing be like? will there be a requirement?
I'm certain that there'll be some type of requirement. I don't know exactly what it is. And again, we're working very, very closely with the host committee and with the DNC to make sure that we have whatever is in place to be effective. I know that there are similar conversations that are going on in Jacksonville, Florida, and Charlotte, North Carolina, the two locations that the Republicans will be where they'll be meeting. But I think that people can assume that there are going to be very, very extensive healthcare precautions taken both at the convention here and at the convention sites, both in Florida and North Carolina.
Thank you, Mayor Barrett.
That's correct. As far as details, all of that information is embargoed right now. So unfortunately, we can't release the details, but you should know there's a plan.
So more to come. Thank you all on today's call. We really appreciate all the context, clarity, and additional information you've provided. And we will see you on Thursday at 2 p.m. Have a good rest of your day.
Thank you very much, Catherine.
Thank
Thank
you.
you.
Bye.
Thank you.
Bye.